Module 5 review. Module 5 has to do with restorative and rehabilitative care. The focus of rehabilitative care is a positive attitude, not only with the client, but also with the nurses. Nurses that have positive attitudes regarding aging recognize that older adults often have a great deal of unused and unrecognized potential. They recognize that most older adults want to retain control of their lives, that a positive attitude does not wait for problems to occur, but it helps prevent problems. The long-term goal of rehabilitation is to help older adults achieve and maintain maximal physical, psychosocial, and spiritual health. And these goals should be challenging but realistic. Rehabilitation is also directed to improving or maintaining the capability of the older adult, and it follows acute illness, injury, surgery, etc., until the client's abilities are restored to the point where the client can return, hopefully, to their previous living situation. So the goal is to return a client to at least the previous level of function. However, that is not always possible. So in that case, we help a client achieve the highest level of function possible. We want them to be as independent as they can be and to be able to complete as many self-care activities, those ADLs and the IADLs, as possible. This requires encouragement and pushing of the client to do as much as possible for him or herself, progressively increasing their level of activity. They need to improve their balance and strength to be able to do this. The focus of restorative care is to capitalize the individual's needs and strengths in a manner that's going to help him or her achieve the highest practicable level of function. Restorative care is for clients that are recovering from an acute or chronic illness or disability and require additional services to return to their previous level of function or maybe even reach a new level of function. The goal of restorative care is to help individuals regain maximum functional status and to enhance their quality of life through promotion of independence and self-care. The focus is on the maintenance of current and previous functioning level and then trying to improve their functioning level if possible. With the current emphasis on early discharge from hospitals, clients often require some level of ongoing care, especially older adults after discharge from the hospital. Restorative care refers to two types of ongoing care. The first type will continue the recovery from acute illness or surgery that started off in the acute care setting. The second type addresses chronic conditions that affect their day-to-day functioning. Both types can be initiated in acute care or an outpatient setting, and they might move to rehabilitation or skilled nursing facilities in addition to private homes or long-term care settings. Interventions post-acute illness or surgery, they're aimed at regaining or improving their prior level of independence with ADLs, may require modification, or we may have to modify acute care interventions to fit a particular client, provide those discharge instructions, and should address the restoration of interpersonal relationships and activities of interest for the client. Promoting independence interventions address the physical ability, cognitive ability, and safety of the client. So again, if there's some issue, they wear glasses, make sure they have their glasses on. If they wear hearing aids, make sure the hearing aids are in. Rehabilitation has the goal of improving the client's quality of life in any way, including physical, emotional, and spiritual well-being. Ultimately, it's going to return the client to a residence of his choice and at a minimal personal risk. It helps clients and families or significant others adjust to necessary changes in lifestyle and learn to function within the limitations of the disease. Services will be varied according to that individual and can include medical, nursing, physical therapy, occupational therapy, speech therapy, social services, and that's just to name a few. Excuse me. Ideally, rehabilitation begins the moment a client is admitted to any healthcare setting for treatment. For example, orthopedic programs may have clients begin physical therapy exercises before a major joint repair. As the condition stabilizes, rehabilitation works to reach a maximum level of function and independence. It does occur in a variety of settings, including special rehab agencies, outpatient settings, and the home. Clients that need long-term rehab may be admitted to a long-term care facility or skilled nursing facility. Then when we look at activity and exercise, we need to look at the client's normal activity patterns. Their activity, exercise, health pattern deals with behaviors related to exercise, their activity, leisure, and recreation. Activity is defined as anything that requires the expenditure of energy. We do know that physical activity is necessary to maintain normal joint mobility and muscle tone, and there are recommendations for exercise for older adults. Hopefully, regular planned exercise is being done and it will benefit the client. Walking is the most common exercise of the older adult. This regular planned exercise can extend years of active independent life, decreases stress, promotes normal sleep, helps improve strength and balance, can decrease stress. I think I already said that. It can decrease blood sugar, strengthens bones. However, older adults need to always check with their primary care provider first. And exercise may require the assistance of a physical therapist to develop an activity plan or training to complete those activities, or equipment, making sure that it's used appropriately. We do know that disease can affect activity. Cognitive disorders such as delirium, dementia, or a stroke can affect recognition of even basic activity needs. Neurologic damage from a head injury, infection, degenerative diseases, or drug interactions can interfere with normal nerve transmission. Disease or injury to the musculoskeletal system can interfere with the ability to perform activities because we have a loss of mobility. Joint pain and restricted activity, this includes arthritis and gout and can cause further loss of joint mobility. Rehab can improve function, and low impact exercises such as swimming are really good for those arthritic joints. Respiratory and/or cardiovascular conditions can affect a person's ability to participate in activity and exercise. Emotional disorders can cause a client's energy to be directed inward, so there's no energy remaining for physical activity. And malnourishment can result in muscle atrophy. We have decreased protein to build muscle, decreased glucose to fuel the body or inadequate fuel. Decreased iron can cause anemia, which can also result in inadequate oxygenation.